here today with Dr. Amy Hartsfield from TMJ and Sleep Solutions of Alabama. We are doing a whole series of videos on just what she does in her business, in her practice. And she helps people who are dealing with things like chronic facial pain, headaches, sleep issues, who are really struggling to find an answer, figure out what the source of the problem is. So in this video specifically, we're talking about CPAPs, which is probably something that a lot of people know about. And the question we're asking is, do you really need a CPAP, or are there alternative treatments for sleep apnea? Kind of what are the other options? So let's just start with the basic. Does everybody with sleep apnea need a CPAP?
No, actually they don't, but some people really benefit from it. So I am a very big advocate for CPAP because it really can help some people. Mm-hmm. But for those that cannot tolerate or do not want it, like for instance, I do have sleep apnea myself, and there's no way. I'm very claustrophobic. Yeah. And so there are other alternatives. There are alternatives such as an Inspire or a nerve stimulator for the tongue, or there's our option, which is non-invasive. And just like a CPAP, it's non-invasive, and it is a dental sleep device. So basically, we make devices for the patients that keep their airway open, and they actually wear them in their mouth. It's like a retainer. Wow. Yeah. Okay.
So let's go back just for a second to struggling with a CPAP device. Is this something that you see a lot of, or kind of what are the issues people encounter with this?
That's a great question, Anne. Yes, actually, if you look at the statistics, 50% of people fail within 6 months on CPAP. My gosh. So it is a known fact of that. People want to say that physicians say that they're successful with their CPAPs, but they're not always successful. Okay. So what I see patients struggling with is, one is basically pressure. I mean, sometimes their pressure, they cannot tolerate it. Another is hose. I mean, because you have the hose coming out here, but you can coming off the top of the head. That one is a little bit better. They can wrap it around a bedpost and sleep with it. But others are, sometimes they get chronic sinusitis and infections and lung infections and things like that. And they keep bronchitis, and yes, after wearing a CPAP. So there's a lot of struggles. And then also sometimes it's the noise. Mm-hmm. One big thing is basically cumbersome, like traveling. Like it's not easy to travel with,
Yes, I've seen my mom do this. She has to, it's like packing a small suitcase.
Mm-hmm. Yes, and carrying it through airport security.
Everything, yes.
Yeah. So, there's other alternatives, and there has to be. Mm-hmm. So, I mean, we have a dental device that is that they can wear that actually keeps their airway open, very small, easy to travel with. It goes in a retainer box, Goodness. So, we have patients that wear them. They're extremely successful with them. And they, it's just easy for them to carry around. We do have some that will wear a CPAP at home, very few. Yeah. And they'll travel with the dental device.
Oh, okay.
But generally speaking, when they experience the dental device, and we test them to make sure that they have treated their sleep apnea. We can't just do a dental device and say, oh, you're fixed. We have to go back for a sleep study.
Okay.
And so if those people go back for a sleep study and they see they're successful with the dental device, a lot of times they'll just pick the dental device.
I imagine it would be hard to go back to the whole mask and hose situation if you can just use what's basically a retainer.
Yes.
That seems a lot easier. Mm-hmm. Are there other alternatives aside from the device, or is that kind of the best one?
There are more invasive alternatives. So basically, I feel like the two most successful of any of them, are the Inspire or hypoglossal nerve stimulator. It's where they put basically something under your clavicle, and it has a lead wire up your neck into your tongue. And when your tongue falls back, it actually it sends a signal to that tongue to contract. But it's invasive.
Yeah.
And so then the other is orthodontic surgery. That's with my colleagues, oral surgeons. If they qualify, then they would have braces, basically break their jaws, remove them forward, and open their airway. But again, those aren't always successful either, and they're very invasive.
Very. Sounds like it would be quite a recovery.
Yes, yeah. And so that's where, you always want to look at the non-invasive things first.
Okay. Well, I love that you guys have this just very simple device that could potentially be the solution. That sounds very easy.
Yeah.
So you described the device earlier. You said it's very small, and you said it opens the airways up. I'm curious how something that looks like a retainer can open up airways.
Sure. Okay. Well, actually, I brought one with me.
Good.
Yes. I mean, there are many devices out there.
Yeah.
A lot of ones that we can choose from.
Yeah.
There are ones that are my favorite, that
Yeah.
I like to use if a patient is a candidate. And so this is one of my favorites. But basically, this is a device, and it literally is, 2 clear retainers. And so it is like you wear this on your top teeth. This is on your bottom teeth.
Okay.
And what this does is, as this closes together, it keeps your jaw from falling back. So it's hard to do with this model, but if a patient's sleeping, the jaw falls back, and the jaw is attached to all the muscles of the tongue and, basically what we call the oropharynx. And so what the device does is it keeps your jaw from falling back. And kind of one of the misunderstandings about these devices are that they cause TMJ disorder.
Oh, really?
Yes. And people think that you have to pull your jaw out and forward, to open that airway.
Okay.
And it's not always the case. For one, let's go back to TMJ disorder. Did they screen the patient before they started? And were they a person that already had pain? So me, as an orofacial pain specialist, I'm going to get into that, know. The other thing was it done properly? We do have training for this, and there is a method to it, and you can't just put someone in a device and just say, pull their jaw all the way out. And so it doesn't cause TMJ disorder if you know what you're doing.
Okay.
But also kind of another misunderstanding is, again, like I said, them having to pull their jaw all the way out. I educate patients like if I go take a measurement, we're measuring how far their jaw can go back and forth.
Okay.
And their top teeth are here and their bottom teeth are here.
Mm-hmm.
And we measure in millimeters.
Mm-hmm.
So if your jaw falls back 8 millimeters and only comes out 2, then I'm not pulling your jaw all the way out. I'm actually just keeping it from falling back and open.
Okay.
So, in a prognathic jaw like mine, so I would have to kind of pull mine forward a little bit. But it just depends on the patient. And and the whole misconception of it causing TMJ disorder is not true. Not true.
Yeah.
Yeah. If you know what you're doing.
Right.
If you go to a provider that knows what they're doing.
Okay.
Now, if you go to a provider that doesn't, I've seen that plenty of times.
Okay.
So I have seen it.
Important. That's an important part of this.
That is an important part of this thing. No, you should always go to providers that know what they're doing. Always.
Just general advice.
Yeah.
So aside from people who maybe struggle with a CPAP, are there other sorts of patients that you see who are a great candidate for something like this?
Yes, actually snoring.
Oh, really?
Yeah, snoring. If you've been through a sleep study and you do not have sleep apnea, they can work very well for snoring.
Okay.
Not always. We work with our ENTs. If it's, a lot of obstruction in the nasal cavity, then it's not always going to help all the snoring, but they can help with primary snoring.
Okay.
Some of my patients actually, it depends. That's very hard to say, but I may not put them in this particular one that are TMJ patients and they don't have sleep apnea, but I may put them in something that keeps their jaw from falling back for TMJ disorder.
Gotcha.
So I may end up using one of those. But as for anything else, that's probably the main things is snoring. And I would like to point out too, we talked about the Inspire. And there are a lot of people that really can benefit from it, but it's a very expensive procedure. And a lot of times women, for instance, they'll advertise on Jocks Radio or something like Men Will Hear It or something. They'll advertise to where people hear it. So a wife will complain that you're snoring so loudly, and they'll hear about an Inspire, and they're like, okay, go get an Inspire.
Yeah.
Well, Inspire doesn't always take care of the snoring. It can take care of sleep apnea, but it can't always take care of the snoring.
Okay.
So then we pair the two together, and it works really well.
Okay.
And sometimes actually we use them in combination with the CPAP. So I may have a patient that has really hard uncontrollable sleep apnea.
Okay.
And they have to be on something called a BiPAP, which has, it's 2 different levels of pressure. So anyways, what happens is if we can splint their airway open, then I have examples at offices and little models I can show, and it's hard here, but basically you have to think of it as when this airway collapses, what a CPAP does is it gives positive pressure. That's what the PAP means. It's a positive pressure.
Okay.
And it splints the airway open with the air. But if your jaw is falling back and collapsing, and then not just your jaw, but basically the musculature and all that, then they may have to like put a lot of pressure down there. And then it becomes where it's hard to control the patient, and the patient gets frustrated, or they have to be on a BiPAP. So sometimes when we put them in a device, and we don't have to, again, pull their jaw all the way out, we just have to keep it from falling back and help splint that airway open, then the physician can put them on a lower pressure. They can actually put them on a PAP, just a plain PAP, not a BiPAP, like an auto PAP or CPAP. And we work really well with trying to, we can pull reports from their PAP, and we can change the position of their jaw. As they sleep, we give them different positions, several nights in a row. We look at how well their CPAP is performing, or their auto PAP, I should say. This day and age is auto PAP. And then we can tell them where they have the best treatment. And so we'll communicate that back to the sleep physicians, their physicians, and we call that dual therapy. Dual therapy with Inspire, dual therapy with CPAP. I got to get away from that. Auto PAP. Auto PAP. I don't feel like there's some people that do CPAP, but that's continuous. Yeah.
Okay.
Yeah.
Wow. So lots of different options,
yes.
Lots of different combinations of things,
yes.
Lots of experimenting to find the right solution. This is all very individualized for the person. So tell me a little bit about just why that matters so much, just when you're deciding on treatment for a patient, approaching them as an individual versus, looks like this diagnosis, we'll just do what we always do. You know what I mean?
Yeah, I think that's important, especially in my practice, is that I tell people I don't make a magic piece of plastic, you know, so whether it be TMJ disorder or, for sleep apnea, they may come in with chronic fatigue and sleep apnea. And so it's individualized in my practice because of my background in pain and understanding fatigue and all of that that goes with it. If we treat their sleep apnea and they still have fatigue, then what is it? So in my practice, I want to go beyond like just treating them with an appliance for my sleep patients. I feel like that's very important. Well, actually, I tried to keep my pain practice, to be honest with you, separate from my sleep practice, because technically people, like physicians, and think I just make this,
Yeah.
But basically, my person that runs my sleep department that came in, and he saw how well I was doing in getting people over chronic fatigue with pain. He was like, we need to bring that over here. Okay. So I will individualize, help their primary care physician understand where that fatigue is coming from. So if it's, I know medicines that help it, things that we can do. We look at blood work, sometimes it's even supplementation, like their the vitamin is so low, but we go into all kinds of different avenues of trying to get the patient better. Like, just because you treat sleep apnea does not mean it's going to treat their fatigue. Sure. So that's where we kind of individualize treatment in the sleep side of my practice now. Yeah.
Just look at everything. Yep. Okay.
Going back to actually, you had asked me earlier about hormones.
Yes.
So hormones for women too. Like, I mean, I've had plenty of women we've treated their sleep apnea. And you'll be surprised, Ann, like actually you can have your tiniest woman will stop breathing in her sleep 30 times per hour. And you'll have this big old burly man that just only stops breathing like 7 times, so. Yeah. But anyways, when we treat their sleep apnea, and they're still fatigued, and, middle-aged woman, I'm like, let's talk hormones, right. So and we have the capability now of doing bioidentical hormones, and black box warning has come off the hormones. So, and they are beneficial health-wise. So that's another way I kind of individualize care for my patients.
Yeah. Looking at the whole person.
Yes.
Yeah. I love that. That's great. So if you're watching this video and you haven't watched any of the other ones yet, first of all, I highly encourage you to check out the whole series, because we're covering lots of topics related to pain, sleep issues, fatigue, and other related symptoms. But we have been with Dr. Amy Hartsfield from TMJ and Sleep Solutions of Alabama, and she is dedicated to just helping her patients find answers for whatever they're going through related to pain or sleep or, we've talked about hormone changes. We've talked about all kinds of things. So make sure you take a look at their website. Again, it is TMJ and Sleep Solutions of Alabama. And just reach out if you're having issues with pain or sleep and you want to talk to someone and figure out what's going on. Dr. Hartsfield can certainly help you. So thank you for being with us again.
Thank you, Ann.